Hi, I'm Angie Nielsen. I'm the Vice President of the Australian Dental Association and Chair of the Policy Committee. And I'm here talking with Leanne Eng about the Policy Committee. A lot of the work is about how we shape the profession. So when we talk about policies, we talk about what is our stand? What are we going to hang our hat on for our members in terms of when we're talking to governments, stakeholders about what change we want or what we think should be happening? It doesn't necessarily mean that it's what's happening now. It means what we want to happen as an association for our members, for dentists. So a really great one, a really great example of the advocacy that has happened was all the policy and advocacy work around the International Qualified Health Practitioners, the pathway to introduce dentists overseas for a different pathway from the ADC, which could mean completely different standards to how dentists from qualified overseas can enter and practice on Australian patients. And because of the advocacy work that happened and the positions that we've created, the dental health a workforce report that recently came through that shows that we're actually talking more about a maldistribution of dentists, not a undersupply of dentists, means that pathway for internationally qualified practitioners has come to a standstill. So that was really good work. But I think there's lots of work that we can do as a committee. So the nominations are coming up. It's great if people can nominate if they want to contribute on a broader spectrum, but there's also work that they can do through our advocacy hub. They can contribute to submissions, they can talk to us directly as committee members or through board members or through the Ask ADA. There's plenty of ways that I think that they can get involved to contribute to the profession. What do you think?
And I think for me, because I never really knew what the policy committee did or what most of the committees in ADA do really, how much work actually goes into these committees and how much AD actually does for us behind the scenes. I don't think people really understand how much thought and effort have been put into policies that shape our profession. The infection control, how the ADA collaborates with the dental board, how that defines our scope of practice. Like the ADA is really on the pulse with the changes, like with the Botox changes, with the aesthetic dentistry changes. So I think it's really good to see all the hard work that goes behind it. It kind of gets overlooked a little bit. And I think people can be quite intimidated. I know I was before joining, because it seems like, oh, it's just so far out of reach, you know what I mean? So I think for people who are thinking that, don't. It's honestly such a welcoming community. It's such a good group of people. They will never make you feel less than. And I think they need fresh blood. They need people to come in and, just really drive the committees and
it's that diversity. Yeah. We don't need people who all think the same. We need different kinds of people, different sectors of dentists. Private, public, government, academic, different age groups. So I think having that, being able to talk within your communities of practice, I think is also helps develop your own leadership capability. But it also makes friends for life. I know I gain a lot from all the people that I meet on the committee, and I'm really grateful to be part of that committee. So, for all the members out there, I'd be really looking forward to your nomination or any contributions that you'd like to make to any of the advocacy work. Look forward to talking to you.